The English Nurse by Professor Charles Lane Olmsted. Chapter 9, Surgery, a Gimcheon University presentation. Vocabulary: sterile, sterile. Stitches, stitches. Outpatient, outpatient. Drain, drain. Stent, stent. Intramuscular, intramuscular. And pictured scalpel, scalpel. Amputation, amputation. Neurosurgery, neurosurgery. Discharge, discharge. Elective surgery, elective surgery. Biopsy, biopsy. Pictured transfusion, transfusion. Transplant, transplant. Leaded apron, leaded apron. Recovery room, recovery room. Diagnosis, diagnosis. Admissions, admissions. And pictured surgical kit, surgical kit. Cosmetic surgery, cosmetic surgery. Operate, operate. Tonsillectomy, tonsillectomy. Hysterectomy, hysterectomy. Resection, resection. Pictured operating room, operating room. Top, intravenous, intravenous. Right, gauze, gauze. Prefixes, suffixes, abbreviations. IM, intramuscular. IV, intravenous. NPO, nothing per oral or by mouth. Laparo, abdominal wall. Laparoscopy, type of surgery using camera. Post, after. Postoperative, after surgery. Postmortem, after death. Pre, before. Preoperative, before surgery. Ectomy, E-C-T-O-M-Y, surgical removal or excision. Hysterectomy, removal of the uterus. G-R-A-P-H-Y, process of recording. Angiograph, medical imaging of blood vessels. O-T-O-M-Y, cutting into part of the body. Incision. Laparotomy, incision into the abdominal wall. P-L-A-S-T-Y, surgical repair, reconstruction. Rhinoplasty, surgical improvement of the nose. S-T-O-M-Y, create deviation of natural flow. Colostomy, create opening for the colon. T-R-I-P-S-Y, crushing or destroying. Lithotripsy, target shock waves at kidney stones to crush. Centesis, surgical puncture for aspiration. Amniocentesis, obtaining amniotic fluid from pregnancy. And SCOPY, use of instrument for observation. Endoscopy, using long flexible tube to look inside the body. Sentence patterns. You need to give him the shot intravenous. You need to give him the shot intramuscular. The woman in 302 is having a tonsillectomy. The woman in 302 is having a hysterectomy. The woman in 302 is having a colectomy. My Friday schedule is outpatient cases, all for colonoscopy. My Friday schedule is outpatient cases, all for gastric bypass. My Friday schedule is outpatient cases, all for gastric sleeve. The biopsy is for the lungs. The biopsy is for the kidney. The biopsy is for the spleen. Sentences. Some cosmetic surgeries are done on an outpatient basis. The operating room needs to be sterile so as to avoid infection. The first heart transplant was more than 50 years ago, but now they are common. The biopsy cuts a small piece of tissue to examine. I had a stent put in a vein more than 10 years ago. The vaccine shot was intramuscular. The 2 fingers were too torn up, so we scheduled an amputation. As soon as you can hold food down for 2 days, we will discharge you. The surgery went well, Mr. Smith. Your wife will be in the recovery room for about an hour. Your husband will stay overnight, so admissions is coming to talk to you. Most tonsillectomies are done on an outpatient basis now. When the earthquake hit, he dropped the scalpel onto his foot, so then he needed stitches. Most neurosurgery procedures now include a microscope and robot. Most surgeries we do are elective surgery, such as facelifts and eyelid surgeries. You will be on the intravenous tube while you are here so we can give you medicine. The diagnosis looks good for a full recovery. The surgical kit needs to be sterile. More women in their 40s are getting a hysterectomy to avoid cancer later. A transfusion may be needed if the patient loses too much blood during the operation. This doctor likes to operate early in the morning. The needle drains some pus from the infection on his leg. You need to check the incision every 2 hours and change the gauze if needed. We did a bowel resection since part of it was clogged. I see that dental hygienists, radiology techs, and nurses wear leaded aprons for protection. Conversation A, digestive, between nurse and Jinwoo. Are you hungry? Yes, I haven't eaten anything in 2 days. They wanted to make sure your stomach was cleaned out before surgery. I tried to drink something last night, but that didn't last. You will be on a low residue diet for at least 2 days. You need to give your digestive system time to rest. So I can't eat anything? You can eat certain things like white bread, white rice, eggs, chicken, but not fried. Some fruit like bananas, watermelon, and cantaloupe. And dairy products, but not cheese. Sounds like no pizza, burger, or meat. Correct. And no corn, popcorn, or leafy vegetables. You don't want to strain your system and overwork the bowels, so no trips to the toilet. Questions. A low residue diet sounds A, high in fat, B, greasy, or C, bland. 2. Why does the diet need to be low residue? 3. Have you ever been in the hospital and had a low residue diet like this? How was it? Did you know there are 4 basic diets in the hospital: liquid, soft, regular, and light. The diet you are on depends on if you are preparing for surgery, recovering from surgery, and your medical condition. Diets are modified by calorie intake on whether the patient is needing to lose or gain weight. A liquid diet has a low nutrient value and usually just for a limited time. A liquid diet will be either clear or full. A clear diet has liquids that do not irritate the intestines, do not cause flatulence, do not create residue, and can pass through the body easily. This is usually the first diet after surgery. A soft diet is easy to digest and has more nutrition than a liquid diet. This diet can be mashed with a fork. It needs to be easy to chew and swallow. It can be some cooked fruits and vegetables and some meat. Light food diet needs to be tolerated by the patient because of digestion issues, whether from surgery or illness. Indigestible and less digestible foods, such as some meats, very coarse breads and cereals, and some raw vegetables and fruits, should be eliminated. Also, spicy and highly seasoned foods and anything that creates gas needs to be eliminated. Conversation B, skeletal. This is between the nurse and Haman. Since you had surgery on your knee Monday, you need to go through rehabilitation. Okay, when can I go back to work? What kind of work do you do? I build houses. It depends on how you respond to treatment. You can't do any lifting and you can't climb any ladders now. Is there any office work involved with your job? Nope, it's all outside. Remember, we had to repair your tendons, so it will take time. I know, but I need to get back to work. You don't want to go back too soon and hurt yourself again. Do you remember how it felt when you fell and your tendon snapped? It will hurt even worse if you break the repairs we did. Okay, you don't have to scare me anymore. I get the hint. Is your bedroom upstairs or downstairs? Upstairs. Why? You should sleep downstairs at least the first 3 nights. You don't want to be climbing stairs. The more you stay off your feet, the quicker you will heal. Questions. What did the patient have surgery on? What kind of job does he have? And why will the surgery affect his work? 3. Does it sound like he will need physical therapy? Why did the nurse ask if his bedroom was on the 2nd floor? Conversation C, cardiac, between patient and nurse. Nurse, can I get out of bed? I need to go to the bathroom. Let me check your blood pressure. No, sorry, it needs to be down to 120/80. Why? What is it? It's 138/88. It needs to be lower so you don't bleed from your incision. They ran the tube up from your femoral artery to put the stent in. Okay, but I still need to go to the bathroom. Here is a bedpan. Oh, and they took your underwear off in surgery. I was curious about that. Will I have restrictions with the stent? The doctor will go over that with you, but usually not. Just ease back into everything. You should notice things like easier to breathe and better recovery time if you exercise. So no marathon next week. No intense exercise for a month. No lifting more than 5 kilograms for the first week. No straining to have a bowel movement for the next 3 days. If you have to cough or if you can catch when you sneeze, put your hand on the incision for the next 3 days. Are you serious about the sneezing and pooping? Questions. Why are they worried about his blood pressure? If he gets up and moves around, do you think his BP will go up or down? What does a stent do? Reading, outpatient or short surgeries. The most common surgical procedures conducted in the United States are mainly everyday operations that require short stays after the operation. Most are short in time on the table and not life and death situations. You will still have pre-op work and a follow-up visit to a doctor after to check your status. For some, they can be outpatient surgeries. The more common outpatient surgeries include appendectomy. This is the surgical removal of the appendix, which is done to treat acute appendicitis. Breast biopsy. This is a diagnostic test that collects abnormal tissue to check for cancer. For this, a hollow tube is inserted to remove a piece or a lump of tissue for testing. Finish reading the story in the book. Circle words you do not know the meaning of and underline those that you have a problem pronouncing.